HIV/AIDS, tuberculosis and malaria play a major role in perpetuating poverty in developing countries. And the fact that health infrastructure is rarely in place aggravates the problem further. The World Health Organization estimates that 4 million healthcare workers are needed to fill the gap in developing countries. Not only specialists such as doctors, nurses, pharmacists and laboratory technicians, but also management and support workers. Pfizer is a global pharmaceutical company that develops new, safe medicines to prevent and treat some of the world's most serious diseases. The company boasts the largest pharmaceutical research and development budgets, over $7 billion in 2006. Beyond simply donating drugs and money to developing countries, Pfizer wanted to come up with other innovative ways of helping. They decided to donate their most valuable asset, their human capital, to train and build management capacity in poor countries. To this end, in 2003, Pfizer set up a program called Global Health Fellows, and through this, every year, they send their highly skilled employees to serve on the front lines of health challenges in developing countries.
Companies like Pfizer know how to do lots of things, and we have employees who have many different expertise and extraordinary skill sets. So we wanted to also provide many people in developing countries access to that knowledge as well.
There's 2 in San Francisco.
Pfizer Global Health Fellows includes physicians, nurses, lab technicians, marketing managers, financial administrators and health educators from the US, Europe, Latin America, Australia, Canada and Asia. This is David Cantor. At 54, he is both a doctor and senior vice president of Pfizer Global Research and Development, and most recently, a Pfizer Global Health Fellow with the Columbia University Earth Institute Access Project.
I applied for this position because I thought it fitted my own experience in management and the idea of, especially in terms of strategy. So that was for me the attraction of coming here.
David was selected to serve in Rwanda in Africa. He first spent 3.5 weeks traveling around Kigali, evaluating the state of the city's health centers and why some were doing better than others. He concluded that the differences in the success of the various centers attributed to the skills of those who managed each center, and what was needed was an objective tool to measure and evaluate management skills.
The actual tool we ended up with was really quite radically different in terms of its actual structure, but in terms of its fundamental concept. How do we measure management skill but as a baseline, and then have an easy way to measure it again repeatedly so we can actually see an improvement and set goals using it.
This is Mayange in the Bugesera district. For years, the center was not used by the population because the service was so bad. Many people would queue all day to see a doctor and then find out the medicines he prescribed were no longer in stock. The center used to see only about 10 people per day. Today, after working with David for just a few weeks and implementing the goals he set, they are seeing between 100 and 120 patients a day. More importantly, people's attitudes are changing.
I never delivered at the health center. It was always at home, so it was high risk. But now there's no need to deliver at home, so my daughter came here to deliver.
It's about personnel, to get adequate personnel, qualified nurses, and train them, organize them, improve management. The drugs are well managed, they can do the forecast on time, adequate ordering of drugs so there is no stock out. Everything is well managed, finance. So that's why the improvement.
Since 2003, more than 170 employees from 25 different Pfizer locations around the world have worked as health fellows in 34 countries. Assignments have ranged from helping hospitals improve data collection and information technology to providing clinical training for healthcare workers and supporting the expansion of services at local clinics.
The response from employees has been overwhelmingly positive. The response from our stakeholders and NGOs and governments has been uniformly positive.
This is Alison Hager. She just returned from 6 months in Rwanda, where she worked with the Access Project at Columbia University's Earth Institute and the Rwandan Ministry of Health to build capacity. Unlike David, her task was to implement management systems for healthcare on all levels.
I think it's important for companies like Pfizer and other large corporations to participate in programs like the Global Health Fellow Program because there is such a win-win going on. Certainly people in the countries where Global Health Fellows go to work are benefiting. Poverty is being reduced, healthcare is improving, education is improving. At the same time, the employees who go are learning new skills, they're getting new perceptions on the world, and they're bringing that back to Pfizer.
Alison and David have seen huge improvements in Rwanda. In 2005, there were 120 cases of malaria per month.
And towards the end of 2007, the cases per month dropped to 8, 6, 2, 5. So there was almost a 30 to 50-fold drop in malaria. And you can see this was the epidemic, and it diminished towards the end of 2007. And then in 2008, they've hardly had any cases at all. They've had about 7 or 8 cases a month.
What does Pfizer get out of doing this? You know, a global company today can't simply be content to market and sell its products, no matter what those products are. Because we want them to understand that we're a company that engages in the communities where we live and work. We engage with people who have needs, particularly human resource and health needs. We also think that we get a lot in terms of our employees' growth. They grow a lot when they are in these settings. It gives us a competitive advantage in our recruitment. Many people today want to come work for companies that they believe are socially responsible, and we believe this is part and parcel of what we do.